morning, Sunrisers. I'm Dr. Karen Emerson, and today I have with me one of my clients, Miss Irvin, and this is actually her corgi, Clark. And Clark presented a few months ago very sick. He was very lethargic. Could you just tell them what you saw at home to make you go ahead and bring him in?
Well, I came home from work and he would just looked at me, and he wouldn't get up, wouldn't spin around like he usually does, wouldn't eat, just very lethargic.
Yeah. It was painful too, right?
Very painful.
So they brought him in, and when I went in there to do the exam, of course, he was very lethargic. He was very painful in his abdominal area. I started acting really nauseous, so we went ahead and decided to do some blood work. And when I did the blood work, we also checked his pancreas, because a lot of dogs will present lethargic. Sometimes they'll even be having severe vomiting and severe bloody diarrhea. It kind of mimics that they got into something, but when they have the abdominal component, there's actually a test that we do called a pancreatic lipase test, and we actually did that, and his was off the charts high. So this can be a very serious disease, pancreatitis. He actually presented with acute pancreatitis, meaning it happened really fast. They got him right in, and we were able to get him through it. He did stay in hospital a few days. The pancreas basically, does exocrine and endocrine functions. The main thing it does is it produces insulin. So when it becomes inflamed, the pancreas actually starts to basically eat itself, break itself down, and that can be very scary, because it can make the kidney shut down and it can make the liver shut down, and it is just severely painful. Actually, this is something really serious that humans will experience, and they have to stay in hospital even longer. But Clark stayed in hospital a few days. We had to do antibiotics, we had to do fluids, a lot of supportive care, and he pulled through it. Today we actually tested his blood work, and it's back to normal. So some clinical signs of pancreatitis, guys: if you've got a dog that's kind of going off food, or they're acting like they hurt when you pick them up, or they're just going to the food bowl and sniffing it and walking away, this could be a sign of pancreatitis. So it's so important to make that appointment and let us check him. And I promise your pets will thank you. I hope you have a great week.
WCBI Animal Health with Dr. Emerson was brought to you by Emerson Animal Hospital in West Point.